This conference will now be recorded.
All right, and then if you want to turn your cameras off, you can. Sometimes that helps better for streaming, and then you won't be caught on the recording. Ryan, thank you for leaving your camera on. I'm also going to leave my camera on, and anyone else on the CCR&R staff is welcome to do that as well. So my name is Julie Davis, and I'm the Community Development Specialist for CCR&R in Region 4. And a big part of my job is to put together these peer-to-peer networking meetings, just a chance for providers to get together and connect with one another, as well as learn from some of the guest speakers that we have. So we've been doing a lot of these peer-to-peer events virtually, so that's been a big change, and we hope to continue that in the future. We'll go on here and do some housekeeping. So there are some featured buttons on the bottom left-hand side of your screen. Some of you now are familiar with GoTo, but some of you use other platforms. So your microphone button is down there at the bottom left-hand corner. And we ask that you remain muted while the speaker is presenting, just to minimize any background noise. If you do have something to share, we encourage that you use the chat box. And we may ask you to unmute yourself to share some of your experiences as a childcare provider. So you will find the chat box and the settings wheel in the top right-hand corner. And we will monitor the chat box. However, this is just an hour-long meeting, and we do want to be respectful of your time. So we did previously submit questions, and we will try to address anything additional if time allows. And we will also send out the recording so that you can watch this at a later date if you want to rewatch it, or if you have someone to share it with as well who maybe couldn't make it today. All right, so welcome, Ryan. I'll have you go ahead and introduce yourself, and you can talk a little bit about some of the links we have up here on the screen. And then the next slide, we'll dive into some of those questions.
Sounds perfect. Thank you for having me. I've been doing these kind of across the state ad hoc as we are asked to do. And so it's been so awesome being able to talk directly with you and answer any questions. And so I really do appreciate that opportunity. On this slide, first off, you've got my email address. I'm pretty accessible. I know a lot of you have probably gotten constant contacts directly from me. Please reach out when you do have questions. Also, make sure that you're looking at our website, especially as it relates to COVID-19. We've got tons of resources that talks about our various funding opportunities. There's a frequently asked questions on that. Health and safety guidance that we put out. We try to make sure that we constant contact all of you when we have that stuff and share it out, but our website is always being updated, so be sure to be taking a look there. And then just in general, we have another tools and resources page that we have information on, such as like special education needs, early access. We recently did a webinar for a training opportunity specifically about early access and the Iowa Family Support Network. So there's information about that on there. Just a lot of good information on how you can support the children and families that you serve. So what I'd like to do is I have all of the questions that have been submitted to us, and as Julie had indicated, if you put stuff into the chat box, hopefully we have an opportunity to get to those. But Julie, if you're okay with it, I'm thinking I'm just going to run through all those questions that were sent and hope that that's pretty much everything. But I would like to offer just a little bit of time at the end to obtain feedback from all of you. I know that some of the questions, the answers might still be a little bit vague because, as you know, things turn on a dime right now. And so we're doing our best to keep up-to-date information to you, but there's a lot of players involved with some of the decisions that we make as well.
Yeah, absolutely. That sounds like a great plan. So yeah, go ahead and you can just get us started.
Perfect. Okay, so jumping right in, they're kind of categorized a little bit. So health and safety stuff. The first question on here is the daily snack discouraged from being brought in by preschool families, or should the preschool plan on providing it all year? Understanding that you typically would have families taking turns providing snack for the class. So the most important thing to remember is that you should have policies established as a program regarding the food that's brought from home. And if it's for children under 5 years of age that are not enrolled in school, that you would be looking to supplement anything as necessary to make sure that CACP requirements are being met. So ultimately, that's really not a decision that's going to be made by DHS. That is going to be a decision that your program is going to need, and how that's appropriate or not appropriate for the population that you serve. Okay, so moving on. This is hot button topic right here. Will temperatures be required to be taken on kids prior to coming in the building? So we have been having conversations about this. At this time, our guidance has not changed, but we are continuing to look at that guidance in relation to also what the Department of Education has been putting out as relates to how school districts should operate. So we know that the door drop-offs are becoming a little bit more difficult as numbers increase. We've certainly gotten that feedback. We've gotten the feedback also that you've had some difficult, like the cost of staffing is going up also because of that running door-to-door drop-off. So we recognize the drop-offs and the temperatures are something that we need to be talking about. We are talking about those. I just don't have the answers for you yet. But certainly, you know, as the guidance is updated, we'll make sure that you have that. Okay, sensory tables. Will we be able to use these, or is this advised against? So I would tell you that we would not recommend anything that's communal use at this time. So it's just like going to a buffet. You don't want all the hands and the stuff. So I would definitely, if you have considerations on how you feel you could do it safely, work with your licensing consultant on that. But it would not be my recommendation to do anything with communal access simply because of spread and social distancing. Any other new requirements that we could foresee putting in place? I do not anticipate anything new coming out outside of what has already been identified. I know a lot of people wonder, will DHS require masks? At this time, I'm not anticipating that we will require masks. School districts have been told it's a local decision. I would anticipate that we would also allow that to be a facility decision as well, and what makes sense for you all. Of course, make sure that, and I think it's somewhere down below, I'm probably jumping ahead a couple of questions, but masks are not recommended for children under the age of 2. So just keep that in mind if you are considering the use of masks by staff and/or children. Will specific information be available, such as coronavirus best practice checklist for childcare providers, to ensure on a daily, weekly, monthly basis that all precautions are taken? We don't have anything specific. If the person that had that question has a specific recommendation, I would be happy to talk with you about that. At this time, we're really using the guidance directly from us, and that is done in collaboration with the CDC, Healthy Childcare Iowa, and then of course you can go to those websites as well as resources. So we're really deferring to the experts on this, but I'm happy to have a conversation about what that might look like. Okay, so for the fall, do childcare providers need to keep their childcare group completely quarantined? For example, question mark, field trips. So while we would discourage some of the field trips where you are unable to effectively social distance, we are not requiring you to not do field trips. So it might, going to the zoo might make sense as an outdoor thing. You have small groups of kids that maybe you have spread out. Maybe going to the science center is not the best plan if you also know that 3 other school districts are also going to go on the same day. So you really just need to kind of think that through, but we are not going to tell you that you cannot go. Okay, this one looks like It's specifically a child development home that's probably asking, but of course it's going to relate to centers as well. Simply, we're allowing different families with different exposure into your homes, and it's unsettling. Do you have suggestions on how to keep the families we provide for aware and stress the importance of keeping up with the social distancing? I think that this is something that we are seeing across the nation, across the state, across our local communities. We know that as the governor lifted restrictions, it was like, coronavirus is over. It's not a thing anymore. We want to go back to normal. We want to, go to Adventureland. We want to go eat dinner, and we want to go to the bar, and we want to do these things. So I totally get that. The only thing that I can really offer is that you continue to have those conversations with your parents about your own concerns. You do have the ability, to make decisions for your program. And I would just recommend that whatever policies you want to implement, that you have those written so it doesn't look like you're choosing one family over another or anything like that. But if you want to say anybody that travels outside of the US can't come back for 2 weeks, you do have the ability as a business owner to make that decision. You just need to have it as part of your written policies. So, certainly just continue to have conversations, provide them resources, have flyers up, continue to wave the red flag that COVID is not over. That maybe isn't a great answer, but I think it's just I think everybody's having a natural response to being tired of isolating, and we need to continue to have the conversation so that people don't minimize the risk, especially as school starts.
Absolutely.
Okay, do you think masks will be required? So I did answer that. At this time, we're not requiring it. Staff are recommended, but as a private business, you can make those decisions. Let's see here. Okay, in the DHS case reporting and response document, dated 6/23, it states that a close contact to a person who tests positive for COVID should self-quarantine for 14 days. And if they're tested and test negative, they still must self-quarantine. As an in-home provider, you have basically said close contact is inevitable. And when school starts back up, kind of what is this going to look like when parents are teachers? So without reading the entire question, the best way that I can describe this has to do with close contact and exposure. So close contact is specifically when it's with a person who has tested positive. So for example, if a parent is in close contact with a positive case, then that person, that parent, should be monitoring themselves for symptoms and self-isolating. That does not move down to the child, because at this point, the child's been exposed to somebody who's been exposed. So we've got kind of a two-step there. If parent then tests positive, now the child is going to be considered close contact to the positive case. So I'm hoping that maybe that clears it up a little bit, but essentially just if mom's a teacher, just because mom is now exposed to a child who tests positive, while mom needs to self-isolate, that doesn't move to the child yet, unless mom tests positive. And we've been working with our public health partners to get a couple of those real life examples to share so that we can explain kind of when this happens, what next. I know that there's been some updated guidance out there too that we're having to continuously monitor and talk about. Okay. What do we do if we are around a friend who works in a factory? Person who works directly with your friend tests positive. So the question was, let's say you have not been around that person for over a week, and when you were with this person, it was only for 15 minutes. Do we alarm families? So these are definitely scenarios that I would encourage you to reach out to your child care nurse consultant on, your local public health. Typically, what we understand about the virus is that it takes up to 14 days to develop symptoms from exposure, but the contagious window is typically up to 2 days prior to having symptoms. So if I have symptoms on Friday, I should be informing anyone that I was around since Wednesday. And so if that was a week ago, I'm thinking it's outside of the scope. But again, talk with the nurse consultants, talk with public health, because they're going to be the ones that do this day in and day out every day. All right. Okay, so what if families you see on social media are traveling and they go back to work? So at this point, Iowa itself is considered a hot spot. Chicago doesn't want us there. Other states are saying Iowans have to self-quarantine if you come to visit us. So the reality is COVID is here. There's not a real way to further mitigate outside of appropriate social distancing and wearing masks and things like that. So again, if you want to have a personal policy that's written in your policies that you don't want people to come back to your program if they are on a weekend getaway, that is completely up to you. But at this point, we have not identified any specific quarantines or restrictions. All right, let's move to classrooms and ratios. I think I have a couple health and safety ones that pop back up at the bottom, but I'm just kind of going down my list here. So classrooms and ratios. Will there be a limited number of children that can be in a classroom at a time, or can we follow our DHS license numbers? Now, this has been a topic of conversation since the very beginning, because we, of course, have recommended what has been recommended for everyone, which was that groups of 10 or less. So while that's a recommendation, it is not a requirement. We have never actually required this. We've just urged it as a way to minimize potential spread. The other opportunities that you have with something like that is just keeping kids in cohorts or pods, if you will. So it's these 10 kids, as much as possible, these 10 kids are always together with this one teacher. And maybe in this classroom, you've got it separate. And then maybe there's less sharing of students between that kind of 5 to 6 p.m. when you typically would blend a classroom as you're waiting for parent pickups. Now, does that impact the number of staff that you're paying to be present? It does. But if that's something that you want to do to try to reduce exposure or risks in your program, those are the types of things that we would suggest. But at the end of the day, it's not a requirement to be under 10. Do you anticipate the limiting of classrooms to 10 to change in the near future? So again, not required. With the school giving the option of online classes, stay at home, will my school age affect my allowed number of kids that I can have? So we are working on the guidance about this right now. I have recommendations to administration, and so I can't give a specific answer. What I will tell you is that I am anticipating that we will be modifying the ways that we count those students that would typically have been in school that would not have counted in your numbers. We'll be looking at those a little bit differently when the only option is virtual online schooling. We recognize that could be a barrier. And as you're familiar, if you're a child development home, we were modifying the care for school agers and the use of part-time hours kind of under that emergency school closing. We are anticipating continuing to allow something of the sort with that. So we will be getting guidance out as soon as, I have the email drafted, friends, so it's coming. I just have to have the okay for it to come out. But these are some of the things I'm anticipating. We have a meeting tomorrow to kind of have any further discussion about those concerns. Okay. So, yep, again, you had the question about will there be an exception to allow home providers to have more kids without having to pay a helper? So one thing that I will point out is that last month there was a House File 2485, that was signed into law by the governor. What this did is it modified the way that we do the emergency school closings. So before it was, school is starts late, dismisses early, or is canceled due to weather, structural damage, something. And it did say that you had to have an assistant once you got up to your numbers. What this actually says is that we cannot, during an emergency school closing, including a public health emergency, that we cannot require the assistant. We want you to try to get the assistant, but we can allow you to continue to provide care to those school-aged kids that typically would have been in school. So the department is required to write rules specific to this. So it's not on your checklist, it's not on the letter, it's not in your like it doesn't live anywhere yet, because this was a law that was just signed in. So we have to evaluate how best to implement that. But this is a great opportunity for us to think about how best to do that. And that should come out, I'm anticipating, with that guidance that we're already working on. Okay. I have a specific question regarding a non-registered home, asking what the guidelines would be and what the numbers look like for that. So typically, that's a state code. So we can only allow 5 or less children to be served in a child care home that doesn't have a registration. I have no authority to modify those numbers in CARE. If you, let's see, would it matter if anywhere on CCA for normal? It would not. Again, it's got to be 5 or less at any one time. And, essentially all rules continue to apply. As you know, we've got some modifications around certain, like CPR certification. It's not necessarily accessible to everyone in every part of the state. So we're being flexible with that. Fingerprints, if you're up for renewal and you need new fingerprints or you're hiring new staff, we recognize that CCR&R isn't necessarily out doing visits, and law enforcement agencies aren't necessarily opening their doors to the public for things like that. So those are things we had to get federal waivers on to continue to work with you under modified conditions. Would we consider raising maximum capacity during the pandemic since there's a shortage? So only in extremely limited circumstances is this something I would consider. Some of you may or may not be familiar with what ratios look like across the country, especially in our home child care. Our numbers are higher than many other states about the number of children per adult. In addition, knowing that we're looking at lifting some of the requirements as it relates to the use of part-time hours and providing care for school-aged children, I would not anticipate that we would allow providers to go over their maximum capacity per category. If we do, it's typically a very short amount of time. It's because it's a sibling in care. It's because, the one child care center that was going to take the child is now closed because of the pandemic, and now they're still in my care, and it's for 6 weeks. So there are very specific circumstances that I am willing to look into, assuming that the provider that's requesting it is typically compliant with all the other health and safety requirements. So I would review past compliance reports. I would talk to the licensing consultant or the compliance worker to really identify whether or not we feel it's safe to increase individuals' capacity. Virtual learning. Bottom line, there's 3 questions here. It's basically, what are we supposed to do about it? And at the end of the day, we have no expectation for you as childcare providers to provide a virtual learning service. If as a program you want to assist children with virtual learning, if that's something you want to build in to support your families, that's awesome. We also recognize that for some of you, that is not going to be an option, and you may not feel you have the capacity. I worked from home since March and tried to also provide schooling support to my son. It was extremely difficult, and I can't imagine doing it with multiple ages. And that's not your role. That's not what you are supposed to do as childcare providers. We like learning by play, right? I mean, we don't want to do the math books. So we don't have those requirements. We're looking at the way that we do the ratios for you in the homes. There's some question around what if I want like my kid and some of their kids or friends, middle schoolers, to do some school all together. I would just say you have to be really careful and considerate about the supervision of your children, any commingling of those youth around your children, assuring that there's no unsupervised access or utilizing them as assistants or substitutes, because then they need to be on your application and background checked and things like that. So we would just expect that, just like any other visitor that would be coming to your home, that you would consider those factors. All right, let's talk money, the CARES money. This is a big one. I know, again, we've had lots of positive feedback. We've had feedback for improvements. Some of you perhaps participated in the survey that we had sent out a couple of weeks ago about that money and how that supported you. So the first question was, what's it going to be offered past July? I am so happy that I was able to get the communication out to you before I had to come onto this call. But yes, so simply the unlimited absent days and the copay reimbursements are going through September. And the stipends at this point we have approved for August, but we don't have approval past that yet. We anticipate expending all of our money, and very quickly. We really figured out we can spend $32 million very fast. I don't remember our current numbers right now, so don't quote me, but I think it's around 18 million or so that we've spent so far. So we will, as soon as we know what is happening in September, we'll be able to continue any stipends, and of course we'll let you know. There's a Senate bill and a House bill out in Congress right now, as many of you might be familiar. Whether or not that bill has money coming into the CCDF dollars, that's our federal money, we don't know that. So we can't anticipate whether or not there's going to be any additional federal funding that comes to the states to further support programs past the money that we've already received. I am sorry about that. Stop it. So that's basically it. I know some of you might have feedback around the essential employee add-on. That was some feedback that we got, that maybe it doesn't pay for itself, that the 25% off for families, depending on the families that you're serving, might cost you more than what we were able to reimburse. So that's definitely some anecdotal information that we have gotten from providers. Okay, so the other couple of questions were, I think most of these are covered. About the temperatures. So again, we're still kind of in process evaluating those recommendations. Now, there's one that says there are discrepancies among providers on different Facebook daycare groups about whether it's okay to have these sensory tables and like dress up clothes, stuffed animals, baby dolls. So please, 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 I love that you're building support networks together and communicating. But please, please, please go to your licensing consultant, go to your compliance worker, go to CCR&R, or email me if you have questions about what is or is not allowed, because sometimes information can be misconstrued. A recommendation can appear to be a requirement, or maybe it's something that we haven't talked about at DHS and we need to talk about. So definitely please share out with those. Utilize each other as support, but definitely maybe kind of try to get it right from the horse's mouth sometimes on some of those recommendations. So then we talked about the quarantining as it relates specifically to teachers. I know that's kind of a big one. And another question about before and after school care, wondering how to handle children arriving off of the bus, group sizes, separation, how to handle if an elementary classroom has a positive case. Specifically, you mentioned having 30 children who ride the bus to and from the center every day. Yes, so we anticipate and we hope that the districts that also you'd have before and after school programs on site will be collaborating with those, and that's why we're really looking at the guidance that we have in relation to what Department of Education has put out, in partnership with public health, so that we're providing some consistent guidance. It's really going to come down to how they decide is most appropriate for the isolation and quarantining with that close contact. So we would expect you as a licensed facility to follow the close contact guidance that we put out, and with CDC, and with, again, the drop-offs at this time, it hasn't changed, but I anticipate that we'll have some more guidance coming out to you related to that. So I totally rushed through like 5 pages of questions, but I'm happy because that means that we have 25 minutes to go through the chat box and maybe open it up for any feedback that people want to provide to the department. I've been in the hot seat regularly lately, so it's fine. Like, bring it on.
Well, yeah, there are a couple questions in the chat box, Ryan. I can just read them out and then you can address them that way if you want.
Yep, that'll be fine.
One is, can we use volunteers if it's a consistent person in the same class regularly?
So volunteers are fine. You just have to follow the regulatory requirements around that. Understanding that if they are in ratio, that you're doing the background checks and things like that. If they're not in ratio, that they're not unattended, that you have the appropriate documentation from them. So yeah, there's no limit to the use of volunteers.
Great.
But I would definitely recommend keeping them with a consistent group of kids as much as possible.
Okay, great. And then there's another one, just kind of going back to the non-registered, so the child care homes, and if there is like an age requirement on that 5 children, specifically questions about maybe wanting to take, 7 or 8 middle schoolers to do that virtual learning and doing that solely that.
So we are not looking at virtual learning as childcare, typically. So if they provide a childcare service and now that child is going to bring their computer and start doing virtual learning, it's still childcare. The kid is already there, but is now doing something additional. If it's middle schoolers and high schoolers, childcare as defined is only 12 and under. So that would not even apply. There's a difference between what homeschool is and what this virtual learning is kind of looking like. Now, what the big difference is enrollment within the district. So homeschooling does have legal requirements under like educational law and how many kids and what the stipulations are. If they are enrolled in the district and they're just getting together a group of friends to do virtual learning together because they're all part of the same class, that is not something that DHS is going to regulate, because we are not going to define that as childcare.
Okay, great, thank you. And then there was just another question around the use of water tables. And I know you said it's not necessarily an allowed, not allowed thing, but more of you don't necessarily recommend it at this point because it's kind of a communal thing.
Yes, yep. So just like we also say at this time, we aren't recommending any kind of family style dining. It's the same thing. So, you know, we've talked about if kids are bringing stuffed animals, like they're going home and they're getting washed every night, so there's a lot of things that have to take place if you are choosing to have kids share those soft materials that are not easily washed. And then, you know, I'm picturing like 4 or 5 kids standing around a water table, like playing and breathing. And when you think about social distancing, when you think about just everybody's hands being in the same stuff without a cleaning mechanism around that, I would not encourage it. But I will say that if you've got some grand plan that you're like, nope, every kid gets 10 minutes and then I have this plan, and you know, we're not going to say no. We're definitely going to say, is it a good idea? You should probably think about that more.
Great, absolutely. And then there was too a question about guidance for before and after school programs. And I know you touched a little bit on that, so I don't know if Sarah, if you put that in the chat box, if you have a specific ask or if there's anything additional being planned for before and after school programs.
Yeah, so if we could get something a little bit more specific on that one, I think with before and after school programs, especially the ones that are operating on site at a school location, there has to be some kind of collaborative nature there. So we recognize that while a childcare license is a childcare license, we also recognize before and after school settings can and do look very different than a quote unquote typical childcare setting, like a Traditions or an Apple Tree or a child development home. So when we do childcare guidance, we try to do it across the entire spectrum, but recognize that there's a difference. So we'll be talking again with Department of Education about what do their recommendations look like to districts, and then what are districts doing, and how does that relate to the before and after school program. And what makes sense, because some of the things that we might have might not make sense. And I think we're all still kind of in limbo. And the reason for that is because which is a good thing, but there's local control that districts get to decide. Des Moines Public Schools does not look the same as, you know, some small rural town that I can't even identify. I know I'm like, I don't know, somewhere out there. But we recognize that those look very different. And because we don't know what all of the different districts' return to learn plans are, it's really hard to try to build in guidance yet, because we don't know what any of that's going to look like. So.
Absolutely, thank you. And then
I hate saying like, I don't have an answer, but I kind of have an answer. That's really hard, but everything changes so quickly right now. And there's so much collaboration that's happening across state agencies and trying to get down to the local levels to provide support. It can just get difficult.
Yeah, it's really hard too going. I mean, yeah, the decisions go through everyone, and at the same time, no one has the same decision because people, you know, are deciding on their own. So yeah, I can't imagine. It's probably very hard. But there was also a question about the use of public splash pads or parks, playgrounds in the areas.
Mm-hmm. Yeah. So again, you know, we're not telling anyone not to go on field trips. We would just ask that you consider what you can do to reduce risk. You know, if you're going to go to the public playground, are they wearing masks? How are you handling it if they're commingled with other kids? If they're using the playground equipment versus open space, just for a change of scenery. So just be thinking about those things. You know, are you bringing hand sanitizer? Do you have access to for example, water. Like maybe we don't want them using a drinking fountain. Maybe we have maybe we have them bring their own water. On our website, on one of those pages under the COVID resources, there is guidance for summer programs. And those are for licensed or non-licensed. It's really just those, a lot of them are like the summer park and rec, city run kind of things. And we wanted to provide some support and guidance to them as well. And so that might be a useful tool for you when you're thinking about some of those outdoor field trip ideas.
Yep, hard to stay inside, especially when it's been so nice this week. It's been a nice relief from the hot weather.
It has, I know.
And then, okay, so there's a question for CCA families on their virtual school days. Can they still access full day care if they have 2 units? Is that correct?
Yes. So what I would say is with your families, and again, it's really hard because we don't know all the return to learn plans, but if families believe they are going to need additional childcare units because the school is not in session and they don't have another place for their child to go, and so they're still in need of childcare, then have them contact their eligibility worker and ask for additional units. So I can't give like a blanket yes to every family. That has to be determined and the individual family need. But if they have 2 units, then yes, you can bill the 2 units.
Great, thank you. And then a question, do you have details on the employee rights? So specifically, if staff are required to self-isolate due to exposure, do they need to use their PTO time first and then get the 2 weeks, or can they use the 2 weeks multiple times if they have to isolate multiple times due to exposure?
So that is certainly outside of the regulatory scope of DHS. So unfortunately, I have no answers for you on unemployment requirements. I'm sorry.
Okay. And yeah, it looks like that's all the questions we have so far in the box. So yeah, I mean, we can open it up to providers too. I mean, if anyone has any feedback at all, you can unmute yourself or put that in the chat box, and then we can share that out too. Yeah, it was nice that we had a few extra minutes at the end. You kind of never know how things are going to go, especially when the guidance is always changing. So it is nice that we were able to address some of those extra questions. And then, you put out more information, and then you have to think there's always going to be questions from that as well. So
yeah, yep. And we, like I've said, we are having so many conversations at DHS, but then across our state agencies, and then of course with you all at CCR&R. One of us is usually on weekly on a phone call, but then also almost daily email correspondence with various questions. And then again, we've had lots of these peer-to-peer opportunities that we've jumped in on and had the ability to talk directly with you all, and that's just been awesome. In fact, I hope that it continues in a stronger capacity once all of this is over, because I do think that we should be utilizing the feedback that we get as much as possible. I see Rochelle just popped a question in. Hand sanitizer was not okay to use. So there was something that came out that just recently, and I would have to look. There is a concern about a specific ratio of hand sanitizer that you would want to pay attention to, but the reality is, yes, I mean, you can use sanitizer. Obviously, soap and water is always going to be your preferred method, but we recognize the high need of hygiene right now. So it's definitely okay to use, but there is a specific concern with a certain ratio. I'd have to go back and find it. Julie, I can send it to you. Yep. If I locate it. I know it's on the HCC, the Healthy Childcare Iowa website, under their recalls. I think it's on that.
Okay, cool. Yeah, if you find it and you send it to me, that's fine. Otherwise, I can definitely look too. I wrote down Rochelle's name so I can follow up with her too.
Sure.
About that.
And And while I'm calling him out, Todd, I know you're on the phone, and I emailed it to you. So if you have it accessible and could throw it in the chat box, that would be cool.
Yeah, then there are a couple other questions in the chat box, like what exactly are the daily cleaning expectations when you have a morning class in one room and then an afternoon class that enters an hour later?
I would have to go back and look at what the recommendations are by Healthy Childcare Iowa. Hold on here. I'm going to try to go somewhere real quick. I don't like taking up too much time looking up stuff on my computer while I'm talking to you all, but let's see here. Okay, I'm gonna copy this into the chat box. I don't have a specific expectation around when things are done. Obviously, yes, in between two different classroom settings, it would be appropriate to do some cleaning. This would be, it's really implementing the regular deep cleaning practices, and then, making sure we're washing hands, using whatever protective things that we can do. I don't have, let's see, in here, I don't have anything specific that we identify. We point you to the resources at the Department of Public Health on how best to properly promote the cleaning.
Okay, and then there's another question. In the case of a fever, does a child need to be fever-free for 24 hours, 48, 72 hours? That the information has been somewhat conflicting.
Oh, my friends, I was hoping I was going to get away with not having this question, and I'll tell you why. So we in support of the CDC, so the CDC had identified what was being called the 10-3 rule. And this had to do with, so I guess, Tara, my clarifying question would be, are you specifically speaking of people that are positive for COVID or people that maybe have symptoms and have tested negative? Because the answer is, of course, going to be different. But I'm going to make an assumption that we're talking about, the idea that flu season's coming and we might have things that aren't COVID. And so, again, there was this 10-3 rule that was basically saying, if you're positive or if you have these symptoms, but you have not been in close contact with anyone that's positive, then after you've not had a fever for 72 hours, your symptoms have improved, you don't need to, you can go back. Now there is what the CDC has identified is a 10-1 rule, which I have not looked too far into yet because we actually just kind of found out about it. So I am anticipating that the guidance that we have will change and that you may get conflicting information simply because I think public health is like, they're up on the current information and then we go, oh shoot, okay, here we go. So we might have a gap in what is written in our guidance in relation to what guidance you might get from local public health in the event that something like that happens. So it's really going to come down to, were they tested? Was it negative or positive? Were they in close contact with somebody or not? When did they get the symptoms? Have the symptoms improved? So there's multiple things that are going to have to be evaluated for a child. And it's all going to depend on specific circumstances and close contact with a COVID positive.
Okay, and then we have another question. If a parent or sibling is home with a fever but has not tested positive yet, should we exclude siblings until the results come back?
So I would say that is up to you, and in consultation with local public health and child care nurse consultants, they'll be able to give you the strongest guidance. But again, the difference is, so if parent has a fever, the first question is going to be, were they in close contact with a COVID positive person? If yes, then there's going to be a path. If no, they should still get a test. But if those symptoms improve and they're negative and they haven't been in close contact, then that takes you down a different path. So again, I can't give like a blanket answer without a very specific example of a case.
Absolutely. And then there's a question about center directors. So can directors go into classrooms? And if so, how would they move from a class to class without cross-contamination?
Well, so my blunt answer is yes, you can go into classrooms. You can't move from class to class without cross-contamination. That's just how it's going to be. No matter where I go, as soon as I go somewhere else, if I have the virus, then I have potential to spread the virus. So yes, but it's a both and answer.
Yep, absolutely. And then we had a question, when will fall guidelines be available? Not sure.
So when you mentioned fall guidelines, I'm anticipating that you're asking about the temperature checks, the drop-offs, the things like that. Is that correct? I'm going to assume that's correct unless I see another chat. I'm hoping that they're out soon.
Yeah, she said for programs who are open after Labor Day.
For programs that are opening after Labor Day?
Yes, I believe so.
So yes, I would definitely anticipate that you will have the guidance out. Jolynn, are you part of the constant contact?
Yep, sorry. Yeah, there's a lot of our schools who open that week of Labor Day. So just kind of wanting to give information to families who will be starting at that time. So then I have a lot of families asking me specifically for guidelines, you know, about things that are going to be happening when they return after Labor Day.
Okay, sure. So I would anticipate that you would have the same guidance that we get out as soon as possible to everyone else, because there's nothing that's going to be different for you after Labor Day. I don't know. I'm sitting and waiting for some of the guidance that we've asked for as people. You know, I do the people that are up here cross collaborate, and they'll tell us when they're ready, I guess.
Okay.
I know that's not a good answer. I'm sorry.
That's okay. My consultant has just been kind of calling them summer guidelines, the ones that we've had. So then I'm like, well, what about the fall?
Yeah, no. So I would not necessarily differentiate the summer versus fall. We have the overall guidance. The summer guidance was really an effort for us to provide support to programs that are not just licensed, but like I said, those Parks and Rec or city operated or pop-up living history farms. I mean, I was on a call with the Science Center and like a big group of museum folks, groups of people I never thought I'd be having conversations with. But what we did was wanted to provide support specifically around like the field trips and the camps and things like that. So I certainly wouldn't look at them as like an either or, because we still have the overarching guidance that is like one link above the summer guidance on that webpage.
Okay.
Awesome. And then I just wanted to share, I know we have just a few minutes left, so there was some positive feedback in the chat box. Shaylee is a provider that shared that she wanted to give a shout out to DHS and CCR&R for making sure we have supplies, checking in, answering emails, and for offering the monthly stipend, and that it truly makes providers feel like they are heard and that our jobs are essential in keeping children healthy, and they definitely are.
Yeah, and Shaylee, I appreciate that feedback, and I do want to point out that I know that there was some feedback that, hey, like, why aren't we being considered an essential employee or an essential worker? And what I will tell you is that us in the Child Care Bureau and really at the department, we recognize, and the Iowa Women's Foundation, I love it, they call it the care force behind the workforce. And what that means is there is no workforce without you. And you are part of the workforce. But you are the ones that have either stayed open or are reopening and have so many unknowns and are working to keep our children and families safe while continuing to provide support. And so we absolutely 100% value you. And I don't feel like that's enough. I don't feel like I can just say, hey, we value you. But please, I mean, just know that from the bottom of my heart and everyone in my bureau, we 100% are so thankful for you and support all of you and are doing everything we can to provide the best support that we can.
Awesome, thank you. So we just have a couple more slides. I know the next one is just some resources. Let me see here if I can get it to switch. Okay, we've been talking a lot about these websites. I know, I'm sure you've been directed to them before. So just a nice reminder, there are some good resources on the Iowa Department of Public Health website, the Healthy Child Care Iowa website, and then also the Center for Disease Control. They've been, I'm sure, special links for everyone to use lately. And then just the last slide is a thank you. Thank you for taking some time out of your day today. I know a lot of you are providing care while trying to attend the meeting. And thank you so much, Ryan, for being available. It really makes such a difference, like you said, to be able to connect with providers and just be able to talk back and forth and really put a face to a name and all of that stuff. So thank you too for taking your time for being here. My contact information is up on the screen. We did share Ryan's contact information earlier. So you can always reach out to me too, and I can answer any questions or try to figure out how I could get them answered. So
thank you everyone for taking some time. I didn't get to see any faces, but I feel like there's probably some familiar ones out there.
Yep. And so we'll send the link out for the recording, and I'll also send a copy of the slide deck out. There wasn't too much on it, but just in case you need that contact information again. So thank you so much for taking some time to join us, and have a great rest of your day and week.